Oh,
So I'm hoping that the people that will need my services can hear me. And
yeah,
I
and
don't know if we can confirm.
we still have 4 minutes until we start the session. So I think when we, at 1 o'clock, we can start explaining the interpretation, right?
Okay,
Right.
so I just mentioned that I would be accepting in a few moments this invitation to be the interpreter, and that everybody who needed the interpreter would need to select the icon that looks like a globe, select the Spanish language. What we do in the courtroom also is everybody else were to pick the English language, because I'm not sure if that's how you guys have been doing it, but that would be recommended. So I can select that now so we can get going.
All right. Thanks a lot, Fred.
All right, let's hope for the best.
Thank you.
Okay. Joe, do you have anybody in the waiting room now?
No, I do not.
All right. So I think we can start then. Does that seem right to you?
Correct.
It is 1 o'clock.
Okay, great. Welcome to everyone. I know that you're muted now. I'm going to explain a little bit later how to use, the chat function for questions. Our intention is that we would unmute people at the end of the session if we have time, but I'll explain. We're hoping to get your questions and comments by chat room. My name's Lynn Breedlove. I'm co-presenting this session with Shannon Webb and Jason Endres, who you'll be hearing from in a minute. I put a little bit of information about them in the PowerPoint, so I'm going to go to the screen share right now for that. So I'm sure a lot of you probably know Jason and Shannon, or you've seen them present before. My background is mostly the time I spent at Disability Rights Wisconsin as an advocate. Jason is a leading activist and self-advocate in Wisconsin and has done a lot of stuff. I just mentioned a couple of things here on this slide. Shannon is certainly one of the leading experts on employment and transition of people with disabilities in Wisconsin. She's done a lot of training, technical assistance all over the state. So I feel like we've got, I've got some good co-presenters here to do this with. And we're going to focus really on three main impacts of COVID. One is social isolation, one is impacts on employment, and the last one is obstacles to obtaining regular healthcare, not COVID-related healthcare, but just the regular healthcare that people need, and the obstacles that people are facing during the pandemic. But we're not going to dwell too much on the problems. We're really going to try to spend most of our time talking about strategies, things that you could do to overcome these things. So we're going to encourage you to use the chat room. You can start now. Anytime during the session, you can submit questions. We're going to try to keep track of those and respond to as many as we can. You can also use that to just make comments, like if you agree with something we say or disagree, if you want to offer a comment on it, or if you have your own strategies that might be as good or better as the ones we have, please put those in the chat room, and we'll probably try to echo those for people so that they can hear them as well. Also, we have someone from the government who's assisting us on technical stuff. So if you have any technical problems with your video or audio or anything else related to participating in this, you can check for that, and Joe will be monitoring that, and hopefully he can help you through that. You'll also see there's a few slides where there's some links. You don't have to try to copy them down before the slide moves. All of the PowerPoints are archived. You can access it later at your leisure and get the link that you want to get. So don't worry too much about that during the session. So just to summarize in the 3 areas of impact, social isolations, that's been an issue for many people with disabilities before the pandemic, but many people are reporting that it's making it harder now because of the limitations of where you can go and who you can see and social distance. Some people say, you know, they used to have active connections with a lot of friends. Now that's been kind of boiled down to just their family. And of course, if some people don't have active family, then their social circle's gotten even smaller. So, you know, people are talking about feeling lonely, feeling bored, some people saying they're depressed. And of course, the uncertainty about how long is this going to go on? You know, is it going to be better by the spring? Is it going to be better by the summer? Like, when can you sort of look forward to getting back to a normal social life? That's kind of an unknown for people. The second one is lost or reduced employment. And obviously some people with disabilities, maybe some of you on this session have been laid off, hopefully temporarily, with the hope that you're going to return to your job after COVID. But some people aren't sure whether that job is still going to exist after COVID. And some people's hours have been reduced and they're not sure, well, will I get those hours back after COVID? Or will I have to look for another part-time job to have as many hours as I had before the pandemic? And a national report that came out a little while ago in May, and of course, things may have changed since then, but at that time, their survey showed that more than half the workers with disabilities that they surveyed who did have jobs before COVID had either lost their job or been laid off, or at least had a strong concern that they might lose their job in the near future. So that's a pretty serious finding. And then thirdly, some people are reluctant to get their normal checkups or go to the ER when they're not feeling good, or even maybe when they have an injury, or go to the doctor's office or the dentist's office, fearing that they might contract COVID. And then, you know, that could be worse than the thing that they felt like they needed to go to the doctor for. And so some people are missing mammograms, other kinds of preventive care that they should be having, prostate tests, tests for diabetes. And that obviously puts people with disabilities at risk, particularly people who may have had a higher frequency of medical problems than other people. And of course, for people who have chronic conditions where they were maybe used to going in and seeing the doctor or the nurse regularly, that may have slowed down for them or actually stopped. So obviously that puts people at risk for those things. So Jason's going to speak first and share with you some of his ideas about reducing social isolation. So Jason, you're up.
Make a list of people you want to stay in touch with. Parents, grandparents, siblings, friends. Make a schedule also to text them or FaceTime, or like we're doing today with Zoom. Spend some time outside every day, spend some time outside every day, as long as the weather permits. Set consistent bedtimes and wake up times for yourself, so you can you're keeping a regular schedule. Even if you're not working, do some chores that need to be done every day. Make your bed, wash dishes, or pick. Sorry about that, guys. Pick whatever chores are the right match for you. If you don't have a job, look at volunteer opportunities as long as they are safe during COVID. Okay, Lynn.
All right.
All right. Check out some health and safety connected toolkits. WI-BPDD has a great toolkit that you can look at, and it has great ways of how to stay safe during COVID. Information and resources about health and safety, overcoming social isolation, plain language for self-advocates. Stay informed and connected by joining Living Well Wednesdays live on Facebook and Zoom events. I am there. I am every.
That's 11 a.m.
Oh, I'm sorry. 11 a.m. Wednesdays. Go to the BPD mailing list form, their website for announcements.
So Shannon, we're a little ahead of schedule here. Do you want to add anything more about the Living Well project and the toolkit before you start your session?
Just to say that Living Well project is a project of the Wisconsin Board for People with Developmental Disabilities. It's a federal project of national significance that we've been working on for a couple of years and will continue to for about 3 or 4 more years. And it really is focused on helping people with disabilities be safe, healthy, and connected in their communities. So when what part of what we've been trying to do in that project, among other things, is to create a toolkit for people to kind of self-monitor. How am I doing? Are my services working for me? Do I want to do something different? What are the resources available to me to be healthy, to be safe, and to be connected? And so when COVID hit, we had been working on this toolkit idea, but it just seemed like it was so needed. So we worked with our group of self-advocate leaders to create the toolkit. Like Jason said, it is in plain language. We're trying to make it very accessible to people so that they can go through each of the 3 sections to figure out, how they stay healthy, how they stay safe, and things they can do to stay connected during the COVID pandemic. But this, what we hope to do, because hopefully COVID won't be with us forever, we want to make this a more universal toolkit over time that, beyond COVID, that helps people, again, self-monitor and really make decisions about their life and learn the resources that help them stay healthy, safe, and connected. So we will change it over time. And I really encourage you to join the Living Well Wednesdays at 11 o'clock every Wednesday. I'm on them. Sally Flashberger is, as well as Caitlin McNamara, and we work on the Living Well project. But each week we invite in a special guest, and we have self-advocates and families involved in trying to give information that people need to be more self-determined and more self-directed, and learn how to advocate for themselves. So that could be around employment, it could be around social isolation, it could be around your services, it could be about voting, health. So we cover a wide range of topics, and we do those every Wednesday. So if you don't know how to connect to Zoom or whatnot, you can, and you're on Facebook, you can jump on Facebook's at 11 on the Wisconsin Board for People with Developmental Disabilities page, and we live stream it. So you don't have to figure out the Zoom room just like you did today for the conference. So great way to stay informed and stay connected. And really encourage you, if you are looking to stay connected, the BPDD's just social media in general, you know, get on Facebook, Instagram, Twitter, whatever you use. And, you know, feel free to comment on the posts, you know, share your experiences with BPDD. We want it to be an interactive platform and a place for people to connect.
Shannon, I just want to break in for a minute. I see at least one person, Diana, who was trying to get the Spanish interpreter and couldn't get it. I just want to, if you're still there, Diana, I just wanted to make sure that you had gone down to the bottom of your screen. If you see that globe down there, you click on it and click on Spanish, and hopefully that'll work. But if it doesn't work, please send another chat, and maybe Joe can help figure out why you're not hearing the interpreter.
Mm-hmm.
Shannon, did you see any other questions for
Yeah, I did. And
Jason?
one was about the toolkit being in different languages. I will have to check in with the Wisconsin Board for People with Developmental Disabilities about where they may be at the process of putting it into Spanish. I'm not sure about the other two, you know, Arabic or Hmong at this point in time. So, you know, I would imagine that over time we would be doing that, you know, putting it in Spanish at very least, but I will have to check in with them. Someone else asked about the CEUs. So the link for that, Joseph, our DHS moderator, I believe you have that link. And if you could drop it into the chat for people who are looking for the continuing education units, that would be really helpful. Okay, he said he will send it soon. All right. So that's all I see in the chat right now. So I will make sure that I will ask Sally and Beth Swedeen about alternative languages for the toolkit. All right. So I used to have controls to advance the slide, Lynn, on my screen, and now I seem to have lost them.
Yeah, Joe, I don't have it either. Can you figure out what happened there?
Hover over the slide itself and see if it allows you to do it that way. Near the
So
bottom.
you hover over the slide, and then what do you do? Right click?
On your own machine, yeah.
Mm-hmm.
Uh,
Next.
yeah, okay.
Okay.
Well, I'll just have to do that for you, Shannon, unless Joe can get us back in the game with the other way.
Yeah,
I'll
that was
try it.
interesting. They came and went a couple of times. Yeah, Zoom technology. You know, we're all learning these things.
Sorry.
And so thanks everybody for your patience. No, that's quite all right. So let's talk about employment. As Lynn had said, there's a lot of folks out there that were displaced, or maybe they were laid off, or their hours have been reduced, or their efforts to find employment have been foiled or kind of put by the wayside right now. And, you know, there are people that are still working in essential jobs. There are still people who are still looking for employment. So if you are someone who would still like to consider going back to work or increasing your hours or finding a new job, there are definitely things to consider and steps you can take to do that. So don't think that employment is out of the question right now just because, you know, people are, you know, just because of COVID and people staying home, because there's lots of people out working. Okay. So the first, oops, can you go back?
Yeah, I was just testing. I guess try it
Yep.
now, Shannon. Maybe you can control the slides yourself.
Okay, I see the controls came up. All right. So so now it just disappeared again, but we'll figure this out along the way, Lynn. All right. So the first thing you need to do is ask yourself, you know, how much risk are you comfortable with? So there's a lot of households right now where one person is going out to work and other people are staying home. And the person who goes out to work may have to, you know, take some extra measures for health and safety. So making sure they're wearing a mask, they're not around other people, within within less than 6 feet, working in a workplace that's also minding health and safety regulations. Some people have to, maybe change their clothes as soon as they get home and scrub their hands and maybe take a shower, depending on the type of environment they work in. So it's really up to you and who you live with to decide how much risk you're willing to take and the protocols and safety measures that you want to have in place in order for you to work or go out into the community. If you want to get a job and you don't yet know about those safety precautions to take, there are ways that you can learn about them. So that toolkit, the COVID-19 toolkit that we introduced. And then I will also put a resource in the chat in just a little bit, which is was done by Green Mountain Self-Advocates for people with intellectual and developmental disabilities, that really goes through what is COVID, what are the precautions, how do you work safely in the community, and all of that. So it could be a resource for you to learn how to, why it's important to wear masks, why social distancing and hand washing is important, how to look for a safe employer, those kinds of things. Or it could be, if you're a service provider or a teacher or a family member, it could be something you use to teach the person that you're supporting how to do those things. Lynn, can you advance the slide, please?
Yeah.
All right. So the Division of Vocational Rehabilitation is still open for business. They are taking referrals and helping people find jobs. So if you are interested in finding a job, applying for Division of Vocational Rehabilitation Services is an option. If you haven't heard from your counselor lately and you're still, like maybe they put your case on hold for a little bit, and you're still interested in finding employment, you can, or maybe you are now interested in finding employment, you can contact your counselor and get working on that with a service provider. So DVR is still, connecting people with job developers to do in-person services or even virtual services. So services over the computer to help people prepare for work or find work. So when you're working with a job developer and you're thinking about employment, it's really important for you to understand the levels of risk in the environments that you may be looking for a job in. So, low risk work environments are, working from home if you can, working in an office with where very few people, a small office where very few people work or isn't open to the general public. Working outside in outside jobs is pretty safe right now. Or else working in a place where you can definitely maintain more than 6 feet from somebody and there's, wearing masks. Somewhere that's what would be kind of medium or moderate risk would be, stores, hotels, libraries, schools, office buildings where, there's more people or they're open to the public. It's still really important for those places to, have protocols in place for mask wearing and, cleaning surfaces and keeping people apart. High risk places right now are nursing homes, hospitals, bars, some restaurants, gyms, or fitness centers. So if you've typically been employed in those environments, or you're hearing that they're hiring a lot, those are really high risk places. And so you may want to kind of consider, are you willing to work in a high risk environment? I noticed in the chat somebody said that they've heard that DVR referrals are low throughout the state. So now is time to reconnect. So thank you for putting that in there, Megan. Absolutely. DVR, I was just talking to someone from DVR yesterday who, they do want people to be applying for services. They realize that, a lot of people are being cautious right now, but they feel there are things that they can do with people to prepare them for work or address barriers or get job training right now that's safe for them. Right, next slide.
One new slide.
Yep.
Whoop. That way didn't work, so I'm going to try this way. Okay.
All right, thanks. So there are, like I mentioned, there are virtual employment services out there, whether it's through the Division of Vocational Rehabilitation, a service provider that you're used to working with, or long-term care, meaning family care or IRIS. So virtual employment services right now can be used to help prepare people for work, help them learn how to look for a job, and then also get support while on the job. So instead of having a job coach right there, maybe you have coaching supports through your phone or through a tablet or a laptop. DVR, so Division of Vocational Rehabilitation, does have an online work exploration service that they're offering right now. It's called Explore Work. And I did put the link to that if you're interested in finding out more about that in the PowerPoint here, which is available on the Self-Determination Conference website. You know, some agencies out there are offering what's called skills to pay the bills in virtual Zoom rooms or classrooms like this. So skills to pay the bills is all about working on those soft skills or essential skills for employment. So if that's something you feel you need to work on, or your family member or someone you work with, that's definitely a service that's available right now virtually. Some agencies are offering what's called virtual pre-vocational services. So pre-vocational services, when they were in person, sometimes were, working in a work center or volunteering in the community, or sometimes, doing things in a classroom type situation to learn about work or explore different options, doing job shadows and, learning about employers. So some agencies have figured out creative ways to offer virtual pre-vocational services. Again, services that help people get ready to work, help them explore what their job goals are and learn about their skills and abilities. So, and then some agencies are still doing in-person pre-vocational services. So, again, practicing safe protocols, whether that be at volunteer sites or in a work center or, a community group of some sort, they are still in operation in different parts of the state. Next slide. All right, another resource that might be of interest to you to build your employment plan during this downtime would be to tap into the self-directed employment planning modules on the In Control Wisconsin website. So these are 10 learning modules that self-advocates, families can go through to learn about resources that help with employment planning and how to address barriers to employment, figure out what your goals are, do some skills inventories, and really put together a plan so that when you go back to DVR or back to a service provider or jump back into that job seeking process, that you have created your own plan and you have questions or things that you need help with. And you can share that with your counselor or your job developer so that your outcome will look more like what you want it to look like rather than what somebody else thinks it might look like. So definitely is an option to, it comes with a workbook and a resource guide. So if you're looking for something to do right now and you really want to figure out your employment plan, that would be a really great resource to check out. All right, next slide. All right, so another strategy to consider about regaining employment is to work with a job developer or maybe your family member, or you could do this research yourself to learn what businesses are hiring right now. There are certain sectors that are really looking for people that have been busier than ever because of the coronavirus. And those might be jobs or places, environments that you want to work in. So grocery stores are hiring a lot, convenience stores, certain manufacturing sectors, big box retail stores like Target and Walmart, cleaning companies, and assisted living facilities. So some of these are higher risk environments, but if you're someone who can follow those precautions, you don't have any health conditions, underlying health conditions, and the people you live with don't have underlying health conditions that you have to be concerned about, perhaps working in one of those higher risk environments is not too concerning for you. So it could be something to consider. All right. Another strategy to think about using during this COVID pandemic, whether you're a job seeker or a job developer, is to think it's called customized employment. And really what it is it's tailoring a job with an employer that is based on what the employer really needs and what you can do well. So customized employment actually with the changing workforce needs and changing needs of employers right now, because maybe they have tasks that aren't getting done around, cleaning or preparing things so that the environment for customers can be safe. They have new tasks that maybe they're is taking up some of the time of employees that have to do other essential tasks at the workplace. So it may be a good time to negotiate or create a new job based on what you can do. So there are job developers all over the state who know about customized employment strategies. And what these job developers do is work with employers to get to know what their new needs are and really, tailor these positions. So if that sounds interesting to you, then you can ask your Division of Vocational Rehabilitation counselor about that, or the job development agency that you're working with to see if that's an option for you.
So Shannon's put out a lot of really good stuff for you guys. Some of you may feel like, wow, that's a lot of information coming at you. When she talks about working with DVR, virtual employment services, self-directed employment module, customized employment. But remember, the good news is she's giving you some really helpful links there. So, if some of that you feel like, well, you want to really learn more about it, we encourage you to use those links. The other thing is, if any of you right now are trying to find a job and you want to use the chat room to say a little bit about what your strategy is, or maybe what obstacles you're running into, we could see Shannon might have some reactions or ideas for you. So if you want to use the chat room for that, feel free to do that.
Yeah, I was just opening it up, Lynn, and taking a look. Someone said the DVR process is slow, but it is a little fast. And then someone else chimed in, it's been faster for them now because, referrals are down. So they get, can get the packets out the door. They can get in touch with people faster. So, give it a try again. If it's been a long process for you before, maybe it'll go a little bit faster this time. Let's see. Some people were saying that they know about skills to pay the bills. Joe works at Walmart, which is medium risk. So, and obviously he's comfortable doing that. And then Chad had mentioned that something that's always worked for him was reaching out to previous employers and contacts. So, maybe you had worked with an employer in the past and might be interested in working for them again, directly reaching them, contacting people in your network to find out about employment opportunities. That's the one thing about employment is more than 80% of all jobs are in the hidden job market. So they're never advertised, and you find out about those by talking to people and contacting employers directly. So.
Joe, when you mentioned you worked at Walmart, maybe you could use the chat room to tell us a little bit about what safety measures Walmart is using to try to protect their workers. That's an example, as you say, of a medium risk job, and people who are thinking about a similar job like Walmart or Costco or something, they might be curious to know, what Walmart is suggesting for its workers or requiring its workers to do to help you guys stay safe.
Mm-hmm.
And maybe Shannon, you could say a little bit more about some people who are working now or are getting new jobs now. Like, what sort of precautions you've been hearing about employers using, in terms of testing or masks or social distance or anything else?
Yeah. So some of the precautions are obviously wearing a mask, washing hands regularly. Some of them put, if you're in an environment in an office place or somewhere where you're working next to people, or even manufacturing, they put plexiglass up between people just to avoid if someone coughs or sneezes, that kind of going on someone else. Temperature screenings, you know, so when people walk in, you get your temperature taken, and that's logged in a book. Some employers are making it so all employees have to enter and exit through certain doors and not other doors. So yeah, I mean, there's a lot of different things, you know, like I said, with environmental changes and removing touch points, you know, things that people would touch or share, moving people further apart, increasing their ventilation, you know, that kind of stuff. So there's, you know, those are the types of things that if you are exploring employers, you could be learning about, like what environments are safer than others to be working in, and what are employers doing. So some people are putting in the chat, you know, additional things that their employers are doing for safety. So one thing I want to mention too, and this kind of ties into, you know, what some employers are doing around safety, is that some employers actually don't want outside job coaches to come in because it's one extra body or one extra person, and it's not their employee that they can necessarily screen for health and safety protocols, or, you know, kind of direct them to do certain things. So if you're a job developer or a person, you know, that is typically offering job coaching or in need of job coaching, there's an alternative for you now. It's called Partners with Business Paid Coworker Support, and it is available through the Division of Vocational Rehabilitation and the long-term care system, so Family Care and IRIS. And what it does, what Partners with Business is that rather than sending in a job coach, the employment agency works with the employer to designate a coworker who's going to do the extra support for somebody, and the employer is paid for that extra support. So you can find out more about the Partners with Business model on these two links. One is at the Wisconsin Board for People Developmental Disabilities website, and then also the Division of Vocational Rehabilitation's website. And you know, it's a really great alternative for people who don't want job coaches, or employers who don't want job coaches, even when there's no pandemic, right? So sometimes, you know, an employer for some reason or another, usually like security reasons, or you know, the business is too small, they don't want another job or a job coach coming in. And sometimes people with disabilities don't want the stigma of having a job coach. And some employment agencies, it's really hard for them to send out a job coach because maybe they don't have enough at the time, or the business is located pretty far away from where the employment agency is. So this is an option even beyond COVID, you know, that you can consider for workplace supports.
Okay, anything else in the chat room around employment, Shannon, before we move on?
Let's see. Looking, Kyle says, I've been waiting a couple of months for a job developer and have recently been contacted, but was told that finding employment is not looking good for me because of space and the need for job developer. Well, I would, so that's from Kyle. And my word of advice to you, Kyle, is to ask some questions. What do they mean? Why is it not looking good? Is it because the agency doesn't, you know, isn't sure or hasn't been in contact with enough employers that might fit your needs? You know, so I would ask more questions to get at the bottom of why they think it's not a very good idea, or explore different types of jobs that maybe you could be doing. But that to me just seems like a not so great of an answer or a response. So, and if the agency that the job developer, you know, if that job developer doesn't seem to be very responsive to you, what I would do is go back to your DVR counselor and ask them to assign you a new job developer, or help you understand why, you know, why this job developer is saying this, and what else you can do to, you know, get more prepared for employment, or a different type of job, or explore, you know, additional types of jobs that you can do. Let's see, Joe put in his safety measures. So it looks like a sneeze shields, temperature checks, and if you have symptoms, you can't come into work. So yeah, so I think we can move on for right now, Lynn.
Okay, thanks a lot, Shannon. The other impact that we mentioned at the beginning was on healthcare. And just so you know, I'm certainly not presenting myself as a healthcare expert, but what I did in preparation for this session is I spoke to somebody in a supported living agency who has the responsibility of assisting people that they serve, people with intellectual and developmental disabilities, assisting them to get health care. And then I also spoke to a nurse that I know who's in a program where she exclusively works with people with disabilities, and she's involved in helping to make sure that they get quality health care. So I felt like I got some good information from them. And they were actually telling me some pretty good news. What they said was, back in the spring, when doctors and clinics and dentists and hospitals were just trying to figure out how to deal with the pandemic, she said some of their procedures then were kind of spotty and they didn't have really clear policies established. But now she says, where both of them were saying to me that, 5 or 6 months later, they've really gotten much more safe, much more clearly defined policies. And so they feel like going to hospitals now, going to clinics, going to dentist's office is much safer than it was in March or April. And of course, the first thing here is if you are getting services from a residential agency or a supported living agency, and you're not satisfied with the healthcare you're getting right now, or you feel like you haven't gotten any healthcare for a while, don't forget that those staff actually have a responsibility to help you get the healthcare that you need and to help you get it safely. But then the second point is the one I just mentioned. There are now clinics who say if anyone has COVID symptoms or is tested positive, they can't even enter this building. They would have to go to a hospital or another place where they're serving COVID patients. And so if you went to that clinic, you could feel fairly confident that there had not been people coming into that building who had tested positive for COVID. But also, even in emergency rooms in hospitals where they do have some COVID patients, they're now separating the COVID patients from everyone else. And they've got some pretty strong protocols, using separate entrances, making sure that there's no contact between the staff serving the people that have tested positive and other people. So that's encouraging. But then there's a lot more use of telehealth where you're meeting with your doctor on the phone or using Zoom or FaceTime. Because if it's not absolutely essential to do a physical examination of you, and basically what you'd be doing if you went to the clinic was you'd be sitting there describing your symptoms to your doctor verbally. Now, a lot of doctors are saying, hey, we can do that without you having to get specialized transportation to come to our clinic or entering in the clinic and, being worried about any exposure to the virus. So if that hasn't been offered to you, you could ask for that. Or if you're supported by a provider agency, you could ask them to request that for you. And so some people who maybe in the spring and the summer were canceling their physicals or canceling visits or deciding not to do a visit, if you're still anxious about going to a clinic, it might be something that you could get diagnosis and get treatment without actually going into the clinic. And if you have a doctor's visit scheduled and you're nervous about, wow, do I really want to do that? Before you decide, or if you're thinking about canceling it, before you're canceling it, see if you could actually change it to a remote visit, a telehealth visit, and use technology rather than go to the clinic. So I think the big message I was getting is it's a lot safer to get healthcare now in October than it was in April and May. And wherever you are in Wisconsin, there's a very good chance that your local healthcare system and your dentist have installed protective barriers. They've implemented measures to make it safe. I went to my dentist a month ago, and I was very impressed with the fact that there was a lot of cleaning fluid around. There was a lot more plastic and glass barriers between me and other people there. And my dentist, when he was examining me, was wearing a very sophisticated double mask. So I actually felt pretty safe going in there and felt like I would be willing to go back to the dentist if I needed to. So I don't know, Shannon, are you seeing any questions about healthcare or dental care?
Not yet, but you can go ahead and put them in the chat if you have any questions about healthcare and dental care. We're still some employment related chats going on. So if there's, let's see, Esther, she said she's working with a job developer that she really likes through accessible career options. Looks like in the Milwaukee area. Renee, she's a job coach herself. And so she was just saying here that she helps people reach their job and career goals, and that she can help with temporary work or regular jobs, so that and can help people learn, how to work safely. So that can be part of what a job coach does, is help a person learn how to work safely in an environment right now.
Okay, I think I'm gonna stop the share. And that way I can see more folks. I also think, Joe, why don't we unmute everybody, and people who have a question can raise their hand. You can still keep using the chat room, but if some people would prefer not to use the chat room, we can open it up with the time we have left.
Yeah, and I'm curious to hear too what people are doing to, about to address social isolation. I mean, we are all in this together, and it's really challenging right now. Like, how are you connecting with people in your life so that you don't feel so lonely?
Yeah, so Joe, I'm still seeing some people muted. I don't know if you can, well, I can individually unmute people. I thought I could. Okay.
You just unmuted. Are you going to say something?
Zachary, you got your hand up?
Yeah,
go for it.
Earlier in October is my birthday month. So what I did basically was had my family over. We all live in the same house, so, and my family and had a friend over who wore a mask. So we connected.
How many people did you celebrate with altogether?
Well, my family, so that's 6 people. And one other person.
So 7. And had you already been having contact with your family before that?
Oh yeah, we've all been, yeah.
So in other words, you already felt like you were safe with your family, and then this other guest wore a mask. And so overall, did that feel pretty safe to you?
Yeah, and I don't actually leave the house to do school. I do all my school through Zoom. So
well, yeah. Thanks for sharing that example. Other people want to respond to Shannon's question, like what you're doing to push back against feeling isolated. I know, Chad, you've got a lot of friends in the community you live. Like, how's it going for you?
I'm on Facebook every night, and I go to work every day.
And you got friends at work, right? So part of your social life is really your work friends too, right?
Yeah.
Another great way, like I mentioned earlier, is to volunteer. Just until about a week ago, volunteering at our hospital, and we all wore all of the PPE, and all the nurses and doctors really appreciated us volunteers back at the hospital. We were all not able to come in from March until July. So and now we're back. Now we're back not in the hospital again, but finding a volunteer job that is really not medical in the medical field is there's tons of volunteer options out there.
So Jason,
Yeah, and some of them are even online.
what kind
volunteering.
what kind of volunteer work were you doing at the hospital? I assume you weren't doing heart surgery, right?
No, my job is to go between the doctors and the families that are waiting for their loved ones to get out of surgery.
Uh-huh.
I just relay messages back and forth. And when surgeries are done, I take the families to the doctor just to let them know how, the procedures went. And a lot of it is just talking to loved ones that are nervous about their loved ones having surgery, and so a lot of it is just calming down family and making them feel welcome while they're waiting for the surgeries to be done.
Yeah,
Okay.
and I think what Lynn said about accessing healthcare is important. If you have something going on, it's really important to call your clinic and find out how you can be seen safely, or maybe do that telehealth visit. I was just reading in the news how there's been an upsurge in people who have ruptured appendices because they are waiting too long to go to their clinic or to call their doctor, and that can be really life-threatening, and where it's really something mild if you go in right away or call the doctor right away. So if you have something going on, I think trying to figure out how you can access healthcare right now is really important. Someone had asked in the chat, Lynn, if you have to wear a mask going to the dentist or the doctor, and I do believe most healthcare facilities require mask wearing right now, correct?
Yeah, all I can report is my own dental visit. They wanted me to wear a mask from when I walked in the office
Right.
until I got into the chair
That you were at. Yeah.
And then of course I took off my mask so the dentist could do what he needed to do. But
Right.
and then when I left that examining room, I had to put a mask back on. But they also had, when I got back to the desk, they had a plexiglass screen there between me and the person who was telling me what my bill was, and then they had hand sanitizer there. So and also they didn't let people sit in the waiting room. What they said was, come and sit in your car or stand outside, and we'll tell you when we're ready to serve you. So there was no sitting in the waiting room with other people at all.
Yep.
So,
I did put two
I know.
in the chat. Just wanted to point out, I did put that the link to the Green Mountain Self-Advocate website where on the COVID and employment considerations. It's an awesome tool for self-advocates to use. And then I also dropped in a website that's through Volunteer Match, which is a reputable volunteer connecting site on virtual volunteering. So there may be some ways to find virtual volunteer opportunities if you are staying at home all the time right now.
So Jessica Nell, I see that you joined us. Go ahead.
I did, and I think mine isn't necessarily employment in COVID, but I'm trapped in a nursing home with COVID, and I think it leads to a lot of isolation, but putting the mask on and getting out in the hallways just to visit other residents, because that's what we're limited to. And I've been here for a long time. So just focusing on that aspect.
Yeah. So I saw Tricia Thompson here. Tricia, can you unmute yourself? I'm curious to hear if you have any thoughts about any of these things we talked about today. Jessica, you were able to unmute yourself, right?
Yeah.
I mean, I tried to put on the control to allow people to unmute. I can't see everybody at once. So if you show your hands, I might not see it, but if you've got it, oh, Kyla, I see your hand. So go ahead and unmute yourself and let us know what you have in mind.
I don't know. I don't know if people should be wearing masks all the time, but I think it's appropriate to wear them at work or at the dentist office.
Yeah, I mean, I think most people feel like if they're at home, you know, by themselves or with someone they're living with or someone they've had contact with, they could take their mask off. But, you know, and I think some people feel like if they work in a place where they have a private office, they could go into that private office and close the door and take their mask off. But if they're in a workplace where they're, you know, bumping into other people in the hall or in the factory or whatever, I think generally people feel like the mask is a safe way to go. So if I don't see your hand, you can unmute yourself and just start talking, because I can't see everybody on the screen all at once.
I know there's been a lot of questions about what about now that winter's coming? So some people have been getting services like outside, you know, in small groups or things like that. And, or if you're a service provider, you know, there's a lot of questions about what do people do now that the weather's getting cold?
Yep.
Is there, you know, and I guess the one thing that can think about, you know, and is getting a little creative in the sense, I mean, there's two things. One is we live in Wisconsin winter, right? And that's inevitable. But there are some really great fun outdoor activities that people do in the winter, right? And it might be an opportunity to pick up a new hobby or activity, you know, you know, I have a friend who said there's no such thing as bad weather, there's just bad gear, meaning bad clothing. So making sure you have the right clothing to be outside is really important. It's a way to stay healthy and safe, to make sure you have the right boots or the coat or long underwear or whatever you might need. So that if one way that helps you get, you know, get out of the house, maybe take a walk, you know, being outside, visiting with a friend, you know, either wearing a mask or sitting a little further away from you so that you can, again, have some opportunities to socialize, get out, get fresh air. That's really important, and not just staying inside all winter long alone. We want to try to avoid that as much as possible. There are also things like you can put on the bottoms of your shoes so that you don't slip on the ice. So walking in snow and ice is safer. So, you know, if you want to explore those things, make sure you ask a family member or your service provider or your IRIS consultant or family care case manager about ways that you could be safe outside this winter so you can keep yourself healthy.
And, you know, Sharon, that reminds me, there's a lot of encouragement for people to get flu shots, particularly this year. And if some of you have never gotten a flu shot or you're thinking, wow, you know, I really don't want to do that, that might be something to, you know, call your doctor's office and ask them, would they advise you to get a flu shot? And very, very few people have significant side effects of flu shot. You know, sometimes your arm might be a little sore for a few hours, maybe even a little bit into the next day, but a lot of people don't even have that. And what, you know, I think a lot of doctors are saying now is this would not be a winter that you'd want to get the flu. because the combination of the flu and COVID would be pretty unfortunate. And one of the ways you avoid that combination is getting a flu shot. So, you know, I'm not the person saying you should get a flu shot. I'm saying you ought to ask about it if you haven't gotten one and see whether you think that's a good idea. That maybe there's some reason for some people not to get them, but I haven't heard much about that.
Chad, it looks like you wanted to say something. Chad, did you want to say something?
Yeah, go ahead, Chad.
I've been trying to get into the pharmacy. I went in a month ago to get a flu shot. They're completely out of all but people ones for the elderly. And I've been on a waiting list for a month and I still haven't heard anything.
You have a primary physician too, Chad? I mean, could you call your doctor's office? Because they may have a
But
supply of.
I usually always get my flu shot at the pharmacy just because it's like 0.2 of a mile away.
No, I know that's really handy. That's handy for me too. But I'm thinking if you're on this wait list and you think, wow, maybe I won't be able to get a flu shot, then you might want to think about plan B and call your doctor's office and say, hey, is it possible for me to get a flu shot there? Because they may have their own supply and maybe they don't have a wait list or they have a shorter wait list. Just an idea.
All right.
So I'm really glad folks got to join us. Hope you got something useful out of this. I think Shannon had a lot of great employment strategies. I'm hoping some people put those to use, and be great to see some people get their jobs back or get more hours if their hours were reduced. And I want to thank Jason and Shannon for teaming up with me on this. So we're out of time. Thanks. And remember, there's links. This PowerPoint is archived. You can go back and get those links, print out those pages, or just click on those if any of those things are useful to you.
Yeah.
So have a good rest of the conference.
Bye, everybody. Stay safe.
Bye.